Let's imagine better health with CHI Health. Some neurological cases are common, but that doesn't make them any less complex.
That might include stroke, epilepsy, dementia, various forms of pain, and that's only the beginning. Our guests use cutting-edge technology to help patients.
From CHI Health, neurosurgeons Dr. Andrea Patil, good to see you, doctor, and Dr. Andrea Chamczuk. Thanks for stopping in this morning.
Nice to meet you both. Good morning.
When we talk about neuroscience, I don't know who wants to take this question, but what does that encompass?
It encompasses the brain, spinal cord, nerves, and spine. So.
What types of cases do you treat most at CHI?
Well, we treat the whole spectrum. We cover everything, including vascular, brain tumors, movement disorders such as Parkinson's disease, epilepsy, pituitary tumor.
Yeah, trauma as well. And when you talk about those health issues, as neurosurgeons, can you correct some of those disorders?
Well, if you have a tumor, you can take it out. Okay, so that's one way. If you have an aneurysm, you can put a clip. If you have Parkinson's disease, you can put a probe and stop the symptoms. If you have a pituitary tumor, you can take that out. So many of them are corrected.
Yeah, there are treatment options.
Yeah, treatment.
One of the things in reading about you specifically that I was impressed with, that you invented a tool that others are now using as well. What was it?
Well, there are actually 4 or 5 inventions.
Okay. Well, I was reading about one in particular.
Yeah, well, there is one tool which is a stereotaxic frame, which lets you probe deep part of the brain through a little tiny needle hole.
So it's minimally invasive compared to what doctors were using before.
Right, yeah. And then there's also an invention, an artificial disc and a cautery machine, but
you're changing lives. Yeah, no, it's true.
Have you invented anything for the broadcast industry?
Nothing. I feel like such an underachiever sitting here right now.
Dr. Chamczuk, I want to get to you. You've been specially trained to perform some procedures. What are they that you specialize in?
Well, I likewise specialize in minimally invasive techniques, and that's sort of the trend that the country's taking now. I did my fellowship training in Europe, actually, to learn about endoscopy, and essentially that involves using a very rigid tube, very small rigid tube.
Is that what we're looking at here?
Yeah, absolutely. So you can see the end of it on the right-hand side of the screen, and then we kind of hold it in one hand and use instruments in the other hand, but it allows us to view the brain on a TV monitor as opposed to doing a very large operation. Here you can see we can use the endoscope to establish different angles to get at the base of the skull, including the pituitary area, which you see sort of in the upper right-hand corner.
And in this case, are you going through the nose?
We're going through the nose. So we go through one nostril with the camera, and then we use our instruments through the other nostril in order to remove tumors. So I think on the next slide you can see just an example. That's a very large pituitary mass there, that big white blob in the middle of the brain.
On the top left picture.
On the top left, and then with using the endoscope, we're able to remove it, and you can see the post-op films on the right-hand side of the screen.
How do you get something like that out? Does it come back out of the nose?
Yes, absolutely. So we're under direct visualization, looking on that monitor, and then just using multiple curettes to try to scoop out the tumor. Most of these tumors are very soft and suckable.
Gotcha.
So we're fortunate in that case.
I am amazed, though, that you're able to do all of that instead of almost like going through the back of the skull, or where like years ago that's what we would have heard about.
Yeah.
But the benefits to the patient must be tremendous.
Well, yeah, it's, especially when we do the intracranial stuff, we're dealing with much smaller incisions, so you're dealing with less pain, decreased convalescence, so you've got a faster recovery time for these patients. And the pituitary resections that we do, the pituitary tumor resections rather, because we've got the camera right there, we can look around corners and get a better result for the patient.
Yeah, Dr. Patil, I have some friends that work on the device side of this. When you describe the techniques that you use to implant a deep brain stimulator, how do you do that?
Well, there are many ways you can do it, but we do it in a very special way where we do it in the scanner. On the scanner, and this is a frame that you can see on the picture, and so you take the picture, the patient is in the frame, you take the picture with the frame on, parts of the frame on, and then you get some markings, the base of the thing at the bottom, the black base. Based on that, you can measure distances on the scanner, and you can then set the coordinates on the frame. And once you set the coordinate, and you put it through the frame, it'll reach the target.
I think deep brain stimulation is something that people are more intrigued by now than even a few weeks ago because of the television special that aired. And so people were curious. We even had viewers writing into us saying, I've had this done in Omaha and it changed my life in different disorders and conditions. But you mentioned something too about trauma and the level 1 trauma center. As patients, do we have a choice? I mean, we're all healthy sitting here now, but when you're in that moment and you need a professional, you have a choice, right, when it comes to trauma centers and where you go?
For the most part, generally we split our call between Creighton and as well as the University of Nebraska. So that's shared between the city.
Our trauma centers, it's terrific, and the level of care, and this whole series we've been doing with CHI, and when we say Imagine Better Health, it's not this tagline, it's to appreciate the professionals, their experience, their expertise, and that they're inventing tools and procedures that are then used all over the world. You're welcome to learn more online at chihealth.com/neurosciences-care, and we'll link you back from our website as well.
Doctor, thanks for coming on. Next time you come on, I'm going to ask you how you become a neurosurgeon. I may want to take up that field. I'm still young enough, right? Thanks, doctor. Thanks for coming on.
Thank you very much. Still ahead.